Back to school season is here, and it's not just about new shoes and school supplies. It's also about making sure your child is healthy and protected before stepping into that crowded classroom. We're joined on this Mindful Monday by Madeline Speltz, a registered pediatrics nurse, to break down what checkups and vaccines your child needs to stay safe. Good morning. Thank you for being here with us this morning.
Thank you for having me.
Yes, an important discussion for sure. So what are the key vaccines that most school-age kids need before they head back to the classroom? We know it differs by age, but what are some of the basic ones?
Yeah, so beginning at age 4, most future kindergartners need their boosters for measles, mumps, rubella, as well as varicella. And then they also need their diphtheria, tetanus, and pertussis, and polio boosters, which are conveniently combined into 2 vaccines, as long as they are up to date on all their other vaccines. And then at age 9, we recommend receiving their first dose of the HPV vaccine. At 11, they're usually due for another tetanus booster, as well as their first meningitis vaccines. And then at 16, they have additional meningitis vaccines they'll be needing.
Oh my goodness. Wow.
Okay, good to know
So
there.
a lot of families fell behind during the COVID era. So what do families have to do now to keep their kids vaccinated and, of course, keep the information rolling as well?
Yeah, so we recommend establishing with a pediatric provider or a provider in a family medicine clinic. And this is a time for them to get caught up on any well child visits, sport physicals if they need those, get caught up on those immunizations. But then it's also a really good time to ask any questions that they may have, concerns, things like that for both parent and child.
Okay, and we know that, sometimes when you do fall behind, maybe you're embarrassed, but, it's okay to be behind, right? Just speak to your provider and you guys will help us get caught up if that's the case.
Absolutely. We definitely encourage reaching out to your provider to see if you are due for a well child. Sometimes in the busyness of the summer or the school schedule, parents might forget, I haven't been there for a while, or I just went with one child and maybe the other child hasn't gone. So we always recommend reaching out to your provider, seeing if you're needing a well child, a sports physical, or if you're behind on any vaccines.
Okay, good to know, and get caught up there. And then anything parents need to bring with us to our child's appointment, like vaccination cards or things like that, what do we need to bring with us?
If you're not an established with our facility, we definitely recommend bringing that immunization record, bringing with any previous documentation from other facilities that you may have gone, but rest assured if you don't have any of that, we're usually able to get those records for you. We also recommend if you need any other medication forms filled out, such as if your child needs to take medications at school, we can definitely assist with filling those out at these appointments as well.
Okay, great to know.
Right on. So what should we know about Winona Health school-based health clinics?
Yeah, so Winona Health, in partnership with Winona Area Public Schools, has established 4 different school-based clinics in the Winona Area Public Schools district. We have clinics at the middle school, the high school, Jefferson Elementary, and the ALC. And through this partnership, we're able to provide at-school care, which is very convenient for families. They don't have to pick up their child to go to the clinic. They can just have an appointment right there at school. We can see kids for anything from well child exams to sport physicals, update their immunizations. We also see children for mental health concerns, STI testing, sexual needs, things like that. We're also really happy to have expanded counseling services into 3 of these schools, so students can see a counselor right there at school. All of course with parental consent for all of these appointments.
Okay, good. So everything from sports physicals down to mental health, you're really covering the whole gamut there.
Yeah, exactly.
All right, awesome. Anything else parents need to know? Any other checkups or anything that should be on our list as we do head back to school?
Yeah, for students entering 5th grade and 6th grade, a lot of times parents they don't realize that sport physicals catch up to them. This is a time when we start those sport physical exams. Though it sounds just like a well child exam, they are different exams, but these are always offered at well child exams, so we definitely recommend not forgetting about those. We don't want your child to miss out on any of those first practices or a new sport that they want to try out. And then we also always recommend yearly dental exams and eye exams with those outside providers.
Okay, great. All right, Madeline, well, thank you so much for being here with us this morning.
Thank you.
No problem. Stay with us. We're back right after this.